I haven't talked to a White House task force. I haven't spoken to either President Trump nor Vice President and President-elect Biden or his team about any of this, frankly. So we make the decisions based on our data. There are a lot of parts of the country that are clamping everything down. They've been clamping down. I think California is a great example. They just keep clamping harder and harder and harder, and their numbers keep skyrocketing and skyrocketing and skyrocketing. It doesn't mean that there's not some benefit to that, but you have to weigh the negative aspects of when you shut down the economy, when you drive the isolation issues, when you drive the other very negative health effects of that. We had to do it in March and April. There's no doubt we did the exact right thing, but that was a very different time. We have more resources available, and we've talked about that, whether it's testing and PPE and guidance documents. And so we just can manage this a lot better and a lot more effective. There's virtually nowhere in the country where numbers aren't skyrocketing. The value that we have, I think, is having that balance that we've been able to maintain, having a strong economy, which creates a lot of not just economic opportunity for families, but healthcare opportunities for families. It keeps people off unemployment. It keeps people off Medicaid. It keeps people more in private health insurance situations so they can get the better healthcare. And we take a lot of pride in the great healthcare we can provide here. So you can go on all day about the positive benefits of not just cramming and shutting everything down when you don't absolutely have to. You know, I think we've struck a good balance. It's all about not overwhelming the healthcare system. So my point being there is, even though the case numbers are higher, we're just managing it a lot better. And so you don't have to just crunch everything down, and the negative effects of that would be quite dire. I'm not saying it could never happen, but I got to tell you, we're nowhere near that. And there's no plans for that right now because of those negative effects.